Hi everybody, welcome to today's video where I'm going to give you a simple overview of NMC revalidation. That's the Nursing Midwifery Council revalidation process in the United Kingdom. I'll be giving you lots of key tips to prepare your evidence for revalidation, and this video is aimed at third year students, newly registered nurses or nursing associates in England, because you start preparing for your 3-year revalidation right from the start of registering. So hopefully the video will put your mind at rest and help with your preparation. So the first thing to say is don't panic about your revalidation. I know lots of new registrants or people coming up to their revalidation start to worry about it and being signed off. Remember, your line manager's there to support you, and they need you registered. So it's to their benefit and the employer's benefit that the revalidation process runs smoothly. You will always be able to find lots of experienced nurses, midwives and nursing associates who will be able to guide you because they've been through that revalidation process already. The NMC has revalidation guidance document on their website, along with lots of helpful forms and templates that you can download and record your evidence. Also, lots of employers might have digital learning hubs where all your mandatory and statutory training and other courses will be recorded in hours. Some employers have a revalidation portfolio where you can upload your 5 pieces of reflection. And that allows your manager to review your evidence before your revalidation meeting. So when you register, or if you move to a different employer, check what resources are available for NMC revalidation and talk to your clinical educator, your line managers and experienced staff about the process, and that, I promise you, will put your mind at rest. It's really just fear of the unknown, and once you've been through it once, it gets much easier. What is the aim of NMC revalidation? If you're a registered nurse or midwife or a nursing associate in England, you're going to be paying for your NMC fees annually to keep on the NMC register, and you'll have a PIN number that employers will request when you go for jobs, and you cannot practice without your NMC PIN. But you also have to revalidate every 3 years, and this 3-year revalidation is required throughout your career. So when you first get your NMC PIN, you're going to be paying annual fees, but you don't need to revalidate until 3 years later. However, you should be keeping evidence for your revalidation from when you register, and keep recording it over 3 years rather than right near your revalidation. And that means then you won't be panicking and having to write lots of reflections in a short period of time. And I'll give you lots of tips later for preparing evidence. So why do we revalidate? The revalidation process really aims to show you that you're keeping your skills and knowledge up to date, and that your practice and behaviours align with the NMC Code of Professional Standards and Practice Behaviours. And the revalidation process gives you an opportunity to reflect on your role, aligning those reflections to the NMC Code of Practice. Just to note, it's 2025 and revalidation requirements may change in the future, so you always check for any updates on the NMC website. However, lots of the information in this video will be helpful on how to prepare evidence, for example. So my first key tip links to NMC Online. So to become a registered nurse, midwife or nursing associate in England, you must use NMC Online. And this is a secure digital service provided by the Nursing Midwifery Council, and it allows you to manage your registration online. To join the register and renew your registration, you use NMC Online, and you also manage your details. You can change your telephone number, your address, your email, and pay your fees using NMC Online. And you also complete your 3-year revalidation using NMC Online. One of the biggest tips that I can give you is that it's really, really important that you keep your profile contact details on NMC Online updated and that they're correct. I have seen students register with the student email, for example, and then they've forgotten to update it. Or a registered nurse, their address has changed and they might have moved out of the university accommodation. But also for registered nurses or experienced nurses of 10 years, they might forget to change that address. And why is it important? It's important because you are notified at least 60 days before your revalidation is due by the NMC online system, or you're sent a letter. And if you don't receive that 60-day prompt, you may forget to do it, and then you risk your registration expiring. And it can take several weeks to become a registered nurse again if you allow that PIN to expire. And if it does expire, you cannot work as a nurse or a midwife or a nursing associate. You're not going to be paid. So it's a really good incentive to make sure that you keep your NMC online details correct. And also you can check when your revalidation's due, when your payments are due every year. You can go online and check it all, check your account, and you can put the dates in your diary, for example. So the second key tip to highlight is the importance of having enough funds in your bank account to pay your annual NMC fees. So your NMC revalidation is every 3 years, but you're paying your NMC fees every year to remain on their register. Usually, individuals set up a direct debit using NMC online. However, if you're overdrawn too much, you don't have enough funds in your bank account, your NMC registration will expire, and the NMC will not take the excuse that there's a lack of funds in your bank account. So you want to avoid this at all costs. Employers will line manage staff if their NMC PIN expires. Firstly, you're practicing illegally without a PIN, and secondly, your insurance and indemnity would be invalid. And if your NMC PIN expires, your line manager will usually send you home, and you can't work until your NMC PIN is back, which can take several weeks. During this time, the staffing in that service is going to be affected. You're not going to be paid during that time. And usually employers will have a disciplinary meeting with you about this, and the disciplinary will remain on your record usually for a year. So if you apply for other jobs, it has to be declared for that year. So always make sure you know when your fees are due and you have enough funds in your account to be able to pay the NMC annually. And as I said, the best way to do that is to set up a direct debit, and you might have an overdraft facility, you might not, but check your bank account when you know your fees are due, and it's your responsibility to check the payments gone through, not the employers or the Nursing Midwifery Council. Before I go through the evidence required in your revalidation, it's helpful to know that there's two main parts really to the revalidation meeting. The first part is reflective discussion, and then the second part is the confirmation part, where a confirmer declares that you've complied with all the NMC requirements. And sometimes people will book, 2-hour NMC revalidation meeting with their line manager and do everything together. So they'll get their reflections signed off, all their evidence signed off with their line manager. Some people prefer to do the reflective discussion way in advance. You can do it up to a year before your NMC revalidation is due. You can do those reflective discussions that year and then go into the confirming of the evidence. But both parts require a sign-off. So there's a specific NMC form for the reflective discussion to be signed off, and then there's a specific form for the confirmer to sign off all the evidence required. So the first part, the reflective discussion, must be conducted with another NMC registrant, and it's highly recommended that this person is your line manager. However, some of you might not have a line manager who's registered with the Nursing Midwifery Council. For example, you might be a research nurse who has a doctor as your line manager, or be an educator who has a physio as your line manager. So you'll have to find an NMC registrant to sign off those reflective accounts. There's a specific reflective discussion form for them to sign, as I said, and you download that from the NMC website. Once you've written all your reflections, you've completed your reflective discussion with the NMC registrant, then they need to sign, record their name, their PIN number, email, the date of the discussion, etc. But you can only have your reflective discussion when you've prepared your evidence. So the next stage, when you've completed your reflective discussion, is the confirmation stage. That happens usually at the end of the revalidation meeting, and once you've gone through everything. The confirmer declares that you've complied with all the NMC requirements you've complied with the hours, the CPD training, the reflections, the feedback, which I'll go through all the evidence later. And it's strongly recommended that the confirmer is your line manager and is an NMC registrant, so preferably the same person who did your reflective discussion, but it does not have to be. The confirmer does not have to be an NMC registrant, so that's the difference. Reflective discussion, they must be an NMC registrant. The confirmer, they don't have to be. They could be a doctor, another healthcare professional, and there's a list of appropriate confirmers on the NMC website. They also, currently 2025, state that the confirmer can be a non-healthcare professional, such as an accountant. There's a list on the website, so there doesn't have to be someone that's a healthcare professional, as long as they understand the NMC revalidation process. However, you're much more likely to be asked for more information by the Nursing Midwifery Council if you use a non-healthcare professional to sign off your NMC revalidation. The NMC selects a sample of revalidation applications every year where they ask for more information. So the key tip here, I would say, is prior to booking your meeting, prior to attending your revalidation meeting with your line manager, is always download the 2 forms, and so they're ready for the confirmer to sign, and the same manager hopefully can do both in one revalidation meeting. But they don't have to. As I said, you could do your reflective discussion first, and then the meeting might be, will be shorter then when you're looking at confirming the evidence. Some line managers prefer you to send the information. So if you've got a digital hub with your employer, you'll have a revalidation section where you upload your evidence, and the manager can look at all that before the meeting, have a chat with you, and then sign off everything for you in that meeting. So that's why I said earlier, always check what the process is with your employer as well, and how they prefer to do those revalidation meetings to sign you off. It's also helpful to look at the current timelines on the NMC website. So the timelines for 2025 are currently that you can meet your confirmer 12 months before the due date to discuss your revalidation. As long as you can demonstrate all the requirements, so if you work full time, for example, you're going to have those 450 practice hours early on. A big tip is to find out a year before who will be doing your revalidation with you, who's going to be doing your reflective discussions, and who's going to be your confirmer. Ideally, it's your line manager, but it might be somebody else. And how do they expect the meeting to be booked and your evidence to be presented? Talk to your managers and current NMC registrants in the area and ask them about the process. And as I said earlier, many employers have learning and development hubs and a structure to support revalidation too. I always book my NMC revalidation meeting with my manager 6 months before the due date, but I'll have collated all my evidence before that. This means that if my manager's off sick or they need to cancel due to work demands, I can easily rebook that revalidation meeting to get them to sign me off later. One thing to note is that if you have your revalidation meeting early and get your paperwork signed off, you cannot apply for the revalidation on NMC online until 60 days before your due date. So you can get all your sign off done, it's all ready, and then you go into NMC online 60 days before, and then you apply for your revalidation, and it leads you through really easy. The process is easy on NMC online. And so your application will be open 60 days before your revalidation application date, and you'll be notified either email and or letter, which is why it's important to keep those contact details up to date on your NMC profile, online profile. So now we'll go through the current revalidation requirements in 2025 for each requirement. And as I said, always check the NMC website in the future, as there may be changes to these requirements. But in 2025, the current requirement is that over 3 years, you require 450 practice hours. So since your last renewal, that's 450 practice hours over 3 years. And also to note, it's 900 hours if you're renewing 2 registrations. So if you're a nurse and a midwife and you're revalidating for both, you need 900 hours currently on the NMC website 2025, but most people will have 1 registration, and that's 450 practice hours. A lot of organisations link staff profiles to revalidation now, and you can just log your hours. Your e-rosters might be linked. There's different ways of doing it, but if you don't have that way of recording with an employer, the NMC website has a practice hours log form, you can see here, which includes dates, name and address of organisation, numbers of hours and description of your work. But as I said, a lot of employers record hours digitally now, and that sort of can be transferred over, and your manager can sort of sign you off, because usually your line manager will know your hours as well. So I hope you find that helpful. So the next requirement is 5 pieces of practice related feedback over the 3 years since your last renewal. And you're supposed to state how this feedback influenced your practice. And this can be feedback from patients, from relatives, carers, colleagues. It can be linked to your annual appraisal feedback. You could use a patient thank you card, for example, or if a colleague said you did something well or that you need to improve in some way, you can ask them to write some constructive feedback for you. It can link to team reports, team performance reports. It's a real variety of feedback that can be used, and you need 5 for that revalidation. On the example NMC feedback log template, you'll see here it includes the date, the source of the feedback, how the feedback was received, and how the content influenced your practice. So the source of feedback could be from patients or colleagues. It was received as a patient thank you card or a staff performance review, and how it influenced practice. So it could be positive patient feedback that motivated you to maintain high standards of compassionate care. It could be constructive staff feedback during your supernumerary time as a new registrant. It could be when you attended a study day and you had feedback from the lecturer on your group work. So you need to ask the people to give you that feedback, so you've got that evidence ready for your revalidation meeting. And you could ask people to do that on email or to write something to give you that feedback. And it's really important to state the impact of that feedback and what it had. So did that feedback have an impact on you and your development, on the team, or on the service or organisation? And you don't have to write lots and lots, but it's being concise and deciding where that impact lies. So for example, positive patient feedback could have developed your skills, or it could promote the trust values, or it could lead to a positive working environment and culture. It just depends on the type of feedback you get. As I said earlier, your feedback can be uploaded on a digital repository. You could have your own portfolio with feedback on there that you've collated, and you show your confirmer. So you've got that evidence there. As long as you always write down how it influenced your practice, and you meet those areas with the date, the source of feedback, for example, the type of feedback and the date as well. Or you can use a feedback log template here, such as the one that the NMC offers on their website. So it very much depends on how you, what your employer sort of suggests as well, and what you prefer. So in 2025, you have to provide evidence of 5 reflective accounts for as part of your 3-year NMC revalidation, and all of you will have used reflection as part of your degrees, whether it's a 2-year foundation degree as a nursing associate or as a registered nurse, and level 6 degree as a registered nurse or a midwife. you're used to writing reflective accounts, and you don't need lots and lots of detail. You don't need loads of references underpinning these reflective accounts, so they should be easy for you to do. The key is not leaving them all to the last minute, because that can be really difficult trying to collate everything last minute. And these reflective accounts can include an explanation of something you've learned from an event or from an experience in practice, and you should include how this reflection has improved your practice. And your reflection should also align to the NMC Code of Professional Standards, and the reflections can be positive or reflecting about a more challenging experience and what you learned. On the NMC reflective accounts form, you'll see that you describe the event and what you learnt, how you changed or improved your practice, and also how it's relevant to the code, such as prioritising people, practice effectively, preserve safety, or promote professionalism and trust. You must always make sure your reflective accounts are anonymised. Patients and staff cannot be identifiable, for example. And also, because of data protection laws, many hospital trusts and community trusts provide a digital repository for your reflective accounts instead of a paper-based log. So they prefer you to reflect in a closed digital system, so data can't be shared or accidentally shared outside externally. So you don't have to use the reflective account form to detail your reflective accounts. It might be that your employer has a digital repository that's set up for you to put those reflective accounts on. So always check what's available before you start writing those reflective accounts, and how your confirmer wants you to present that evidence. Another revalidation requirement includes 35 hours of continuing professional development activities, CPD activities, over the 3 years. This includes 20 hours of participatory learning. And participatory learning is a learning activity where you interact with other people. This can be in person or virtually. So when you attend a conference or a workshop or training courses, or participate in group meetings or online discussions. Self-directed CPD activities can include your mandatory and statutory training. And you'll receive an e-learning certificate of your attendance on a study day, for example, or a conference, and you can log those hours as you go along. You log the hours, the type of learning, the content, what you learnt. And as a new registrant, you should record this evidence from the start. You'll have orientation study days, inductions, self-directed supernumerary learning time in the clinical area, and group teaching as part of a preceptorship programme, for example. So you might find you complete those 35 hours in the first year registered. On the NMC Continuing Professional Development CPD template, you state the learning method, was it online or course attendance or independent learning, for example, the topic, and how it links to the NMC code and the number of hours and participatory hours. As I mentioned earlier, many employers already have records, training and development hours on learning and development digital hubs. So you might not need to use this NMC log template. It's there if you need it. And as I said, some of these templates are transposed onto digital hubs. So see what's available with your employer. If you listen to the start of my talk, I talked about the 2 stages really of NMC revalidation. There is a reflective discussion, and which has to be with an NMC registrant, and then you have the confirmation where somebody signs off that you've met all the requirements, which is the hours and everything else that I talked about on the other slides. So when you have got all your evidence ready for your revalidation meeting, and you're ready to be revalidated with your line manager or whoever's going to be doing it with you, they will have to complete a reflective discussion, and it's an NMC registrant that has to sign off your reflective discussion. They have to review your 5 reflective accounts, and there is this specific form that everybody downloads excuse me, prior to that reflective discussion meeting, where you put your PIN and your name, and then the name of the NMC registrant with their PIN and they put their details and their contact details, etc. It's an A4 form. I haven't put it all on here, but the main bits I've put on here. So you download that form and you get your reflective discussion signed off. So it's really helpful to have that form ready before the meeting. So once you've completed your reflective discussion, you've got all your evidence ready for your revalidation meeting with your line manager or whoever's going to do your final confirmation form. This is the confirmation form, and you download it from the NMC website, and the confirmer ideally is going to be your line manager and an NMC registrant. However, they don't have to have an NMC registration. As I explained earlier, you might be a research nurse, and a doctor might be your line manager, or a physio. Ideally, it's going to be a healthcare professional, but there are a list of alternative confirmers. So potentially it could be an accountant signing you off as a professional, and you have to check the list of confirmers. And as I said, this is 2025. So once you've got all your evidence ready, your reflective accounts, etc., you're ready for your revalidation meeting. This is the confirmation form example, and you can see here they're signing off all the elements that are required. So submitting your revalidation application, you do this on NMC online, and you do it once you've completed your reflective discussion form and your confirmation is all signed off, and you can go and submit your revalidation then online. And it's an easy process. You're led through a series of questions on NMC online. You'll also be asked about your health and character and professional indemnity arrangements to revalidate. So you've got to declare if you've been convicted of any police charges or cautions as part of your health and character declaration, for example. So just work your way through that form. And if you're part of a union, you should have appropriate indemnity cover, but it's your responsibility to ensure the cover is in place. So a summary of just some key tips when revalidating. Collect and record evidence as you go along, right from the start, when you start your preceptorship and throughout your career. Check out what resources the employer has. Does the employer have e-rostering, a learning hub, a digital portfolio to help you upload your evidence? As you may not need all the NMC logging template forms, for example. Always check your online account and record when your revalidation is due in your diaries. Check the NMC website for any changes to the requirements and review the revalidation guidance and templates. Always update your contact details. Make sure you've got enough funds to pay the NMC annual fees, and so you don't let your PIN expire unless you're wanting to leave nursing or retiring. Book your revalidation meeting 6 months at least before it's due to allow for cancellations, but you can book them up to 12 months before, and that's quite helpful if someone's going on maternity leave, for example. And find out how your confirmer expects you to book your revalidation meeting. It might be through an email, it might be through PA, it depends how experienced you are. So make it easy for yourself. Use evidence that you've already naturally collected over the 3 years. So it's not extra work for you. Any reflective essays that you've done, if you do any post-registration courses in the future, you'll have reflections there that you can use. You might have received, I don't know, staff recognition award, thank you cards, annual appraisal feedback, feedback from students or support workers you've supported. And so having that data stored in your digital portfolio or on your revalidation hub in that closed system is helpful to have those reflections ready to go when you're near to revalidating. And also try to ask people for feedback soon after an event rather than a year later as well. That's quite helpful. So I hope you found this video helpful. Do check out my YouTube channel. I've got lots more free videos there linked to critical analysis, research, education, looking at career development and looking at different career pathways. So a real range of videos on there. They're all free, so I hope you find them helpful if you choose to go on the YouTube channel. So wishing you all the best with your revalidations. Good luck. Don't panic. Keep that preparation going over the 3 years and you'll be led through the process. So please don't worry about it. Everybody that's registered experience will have gone through this process and is there to support you as well.